Here are a couple of concepts I want to close with here before I turn it over to Emily. And I have a couple of pretty dense slides for you on this because I just did some writing about it in a very brief kind of way for a book that's going to come out, I think in around November. It's the Handbook of Expressive Arts Therapy. And when I got to a chapter that I was working on, I thought we really need to have a discussion and some explanation of a lot of the culturally relevant concepts that go with expressive arts and art therapy, music therapy, all the creative arts therapies within this context of psychotherapy, counseling, coaching, education, or any place you apply this work, however you're using it to facilitate something as a helping professional. And there are really some very specific concepts that anyone who's applying arts and healing and restorative work ought to be aware of. And this is part of our unique ethics as professionals in these fields. So, I often think like there ought to be more of this literature exposed to play therapists, for example, who use expressive work. I think they think about it, but they're not probably here yet with some of these concepts that are really core values in the expressive arts and really are ethical issues that now we have to focus on more and more because we are getting more, as I said, laser focused on how do we deal with culture? How do we deal with intersectionality? And all the things that go with specifically with the use of arts in those sessions with people, because everybody brings a unique culture to their artistic or just any kind of expression that we see in those sessions. So here's one. This is cultural appropriation. I think it's just incredibly the continuing drama for all arts therapists, whether you're expressive arts therapist, creative arts therapist, something, specific like an art therapist. And, if you go on any given day onto social media and there's an art therapist, for example, very proudly talking about some session or work or training that they're doing, mandala comes up all the time. And we all know that this is something common to that field. If your core is as an art therapist, that particular concept is repeated in a lot of the literature and a lot of the trainings and a lot of the experiences that art therapists give to their clients. But it does come from a spiritual tradition. It didn't come from art therapy, but it's almost equated with art therapy now. People have used other things like dream catchers that come from the Native American populations. And there are all kinds of other cultural traditions that we have to think about. How have we appropriated these? What do we need to think about how we're using them within our work? So, here's a definition of cultural appropriation that I've been working with and tried to describe, as I said, in this next book that's a handbook. So there's so many concepts in there that we need to be exploring, and this is one of them. It generally refers to the use of objects or elements of a non-dominant culture in a way that doesn't respect their original meaning or give credit to their source. We have been constantly doing this in this expressive work. We don't need to make a big deal of it, but we need to acknowledge somehow where this stuff has come from, because it didn't come from art therapy as a profession that's been around for 50 or 60 years. It comes from thousands of years of cultures using these practices, and now we've adapted them and operationalized them within a profession. And, it's part of the learning and the curriculum of what we know and start to use in our work. But they may be used inadvertently to reinforce cultural stereotypes or even contribute to oppression and exploitation in some way. So we need to be more and more careful about this. I think now we have an opening in the discussions that have happened over the last several years about diversity, about people of color, which is another term. Some people that are people of color don't even like that term to be used, but that's the best we've got right now. And from other kinds of cultural traditions within gender, within different settings, within contexts. So that's one thing we need to keep having a pretty open dialogue about and be really honest about ourselves about how am I using these expressive practices, and am I really honoring where they came from, because they didn't come from us in this moment or in these past decades. They came from much deeper places. So, here's a slide I show in the trauma-informed foundation class, and just talk about the fact that neuroscience doesn't tell the whole story, tells some of the story about why expressive arts are reparative. But everything that we're using today came from different kinds of cultural groups, their practices, rituals, spiritual traditions, procedures, ceremonies. They're all, and they were mostly in response to trauma and loss, not always. They were also used as celebration and other kinds of things. But this all came through thousands of years. So how do we negotiate where we are now with what we're kind of appropriating as health-giving practices, which they are. That's why humans invented them to some extent, because they knew that that helped them get through hard times, or that helped them celebrate things that were really important to their community, or help people feel better in some way. So, we need to keep looking back at that. We get off into this whole thing about brain science and why these approaches work. But we also always have to look at the anthropology and the ethnology as these sources of this material, of our practices. How do we think about that ethically? How do we have that discussion? How do we negotiate that? Because we're going to be using these. They obviously have value, but how do we think about this in terms of ethics in our own practice to honor that diversity and the origins of where these things came from? Then there's this last term I'm going to share, and we'll move to Emily's slides and get into our experiential. Cultural humility. So, there's actually definitions for this. These things have been around for a while. It's not new, but we haven't embraced them, I think, enough within the expressive realm, expressive arts, creative arts, all the different arts therapies. National Institute of Health defines cultural humility as a lifelong process of self-reflection and self-critique, whereby the individual not only learns about another's culture, but starts with an examination of their beliefs and cultural identities. So that's where it comes in back to the beginning here of sharing with you my own kind of exploration in brief of whatever my heritage was. That's part of the process, looking to oneself and starting to get an understanding of that, to start to understand someone else's cultural heritage. So that's one piece that's been defined by, government agency, the NIH. So this has been around, but I think now we're starting to think there are many different concepts embedded in that definition, but there are some very specific that we don't talk about enough, again, in expressive arts, in creative arts therapy, in art therapy, music therapy, dance therapy, et cetera, and play therapy I would include on that menu. And any way you use the arts in healthcare or facilitating some kind of helping situation as a practitioner or facilitator. So, here are a couple of them, and just have a couple slides here. There's a little more dense, these slides, but here's something that I was writing about again in that book, that each individual, group, or community has a history, often over generations, that may impact their current challenges and preferences for treatment. That statement actually has to do with trauma-informed care, because that's one of the principles. Sometimes it does get ignored in trauma-informed practice, but it is there as one of the main principles, that we understand where people are coming from in their own, often over generations, but often what is their preference for how they receive help or assistance or co-creation with us. What is their preference based on culture, based on intersectionality? So cultural humility includes becoming aware and sensitive to historical trauma in a lot of people we see, and particularly, obviously, we have the very clear stories of this kind of historical trauma in Native American populations, in the Black community, in the form of slavery. So all of that, these violent, oppressive social justice pieces have occurred in a lot of people that we see. And there may be other groups. I've just named two there. There's obviously other groups that have come through these kinds of things. So, I think the important statement is there may also be experiences of disrespect and abuse by healthcare and mental health systems as well. And that's what we need to understand, because certain cultures, for example, in even this pandemic, have not received the health care that they need because of their racial identity, because of some identity in this mix. And that can even be age too. You just think about different cultures, people with socioeconomic challenges may not have been able to access what they've needed. So that's all part of that culture. It's not just about race. There's all that, what we're going to get to with the intersectionality in that. And I think I have one last one here that I think is pretty important to what we're trying to think about in terms of expressive arts, in terms of creative arts therapies, art therapy, music therapy, etc. That similarly, individuals may have specific arts-based rituals, ceremonies, and procedures that they employ to address trauma, loss, and suffering, or a health-related condition. This is another form of historical awareness that practitioners can tap into in order to provide best practices based on culturally resonant approaches. So, really just what I'm saying here, again, that's pretty much, again, a principle in trauma-informed work that we try to understand, even if we're just doing talk therapy, what is it that is going to be helpful to that person because of their cultural history? And that's really where that term cultural humility comes around again. But with expressive work, we can also, and we should be exploring, wow, what is your definition of art? Are there certain art forms that there are cultures that don't permit certain art forms, for example. Some don't permit drawing. So we need to be conscious of all that. But are there ceremonies? Are there procedures? Are there rituals? Not that we're going to replicate them, but the person in front of us is going to inform us and help us understand where they think curative pieces might be through expression. So that, in a nutshell, is really our ethical challenge to find those out. And of course, I think even back to, our sessions on supervision, where does this concept fall when we're supervising somebody? What's happening with our supervisee around this as well? So I think you know that already, but I just want to come back full circle to that, because that is, something we touched on a little bit in the beginning. And I think that's my last slide. So I will transition over.